Doctors, tell us about your dumbest patient. Once, a child was brought to me who swallowed a large enough magnet. It got into his intestines, so we just had to wait for the kid to come down in a big way. The next day, they bring him to me again, and they say that he ate another magnet. And so it turned out that the second magnet through the stomach wall became magnetized to the first, which led to intestinal obstruction. We had to send him straight to the operating room, where they were surgically removed. A patient comes in with abdominal pain and says, "I think the problem is in the gallbladder." I look at his medical records and see that his gallbladder was removed 20 years ago, so it's impossible. I tell him about it. The answer is, "Yeah, but it looks like he's grown up again or something." A patient comes to me with her mother. Mom asks me to fix her daughter's scrotum. Trying not to laugh, I said, "Should I fix your daughter's scrotum?" To which she reacted as if I were the idiot here, and pointed to the back of her neck. I knew there was no point in correcting her because she wouldn't have listened to me anyway. Plus, I wanted her to keep going and telling other people that. My dad is an orthopedic surgeon who often performs knee and hip surgeries. He has a favorite story that he laughs at every time. Once, a woman was brought to them who did not understand how surgery worked so much that she decided that for hip surgery, they would have to amputate her leg first and then sew it back on. I blame it on the Barbie dolls. My mom works at the hospital and constantly feeds me awesome stories of X-ray technicians. Last week, they had a patient, an adult man, who stuck a huge carrot in my ass. The dude came from some village, and a very conservative one at that. I drove for 3 hours, standing up because he couldn't sit down, for obvious reasons. If I ever decide to change my profession, I will go to radiology. I'm working on an ambulance. They're being called for a stroke. The patient has a sagging face and speech disorders. He says it feels the same as when he had a stroke 10 years ago. She further clarifies that the symptoms appeared 4 days ago, and that she already realized then that she was having a stroke. I'm asking, "Why didn't you call us right away?" I was hoping that it would pass by itself. I once had to explain to a 17-year-old girl and her mother that she wasn't allergic to alcohol, but had an ordinary hangover. Her complaint was that sometimes when she drinks a lot of vodka, especially on an empty stomach, she gets nausea, blushing, and vomiting in the morning. She had no other symptoms of an allergy. Wait, are there people who are allergic to alcohol? 2 stories immediately came to mind. One from me, I am a clinical pharmacologist, the other from colleagues from the emergency room. 1. The story from the emergency room. A 16-year-old boy is brought to them with an unrealistically swollen penis that has lost its natural color. It turned out that the man was stealing his mother's insulin syringes, taking blood from his hand and injecting it into his penis, hoping that the blood flow would help him increase the size of the unit. As a result, this led to a severe infection, which caused him to be hospitalized for a week. 2. A girl comes to our pharmacy and asks for birth control pills. I try it on the computer and see that I can't give her more because less than 2 weeks ago, she already took a package designed for 28 days. When I asked her what happened, she replied that she was done. It turned out that she was taking them with her boyfriend. They thought that these pills were for both of them, and that this was the only way to avoid pregnancy. One day, a grandmother and her mother brought their granddaughter to the emergency room with a complaint of bleeding. But it wasn't due to injury or bruising. It's just that the girl started having these days, and mom and grandma didn't really want to explain what it was and that it was normal, although both perfectly understood what was going on. On the plus side, it was a very quick visit to the emergency room. Once, a 24-year-old prisoner was brought to us, who was in some kind of village prison. The dude was working at the curb near the road, found a bottle in a ditch and decided to drink all the contents, hoping that alcohol was in there. To be honest, I would have thought there was whiskey in that bottle too. But no, there was some kind of substance containing sulfuric acid. The pH level was less than 2.5, so it corroded the litmus test by 1 or 2. As a result, he ended up in intensive care with hellish pain and bloody vomiting. The gastroenterologist gave him a gastroscopy. This is a procedure when they insert a tube with a camera and look at your esophagus, stomach, and duodenum. The picture from the camera was just terrible. You could literally see his stomach and esophageal mucosa corroding. It was decided to send him to another hospital, which found a surgeon who could fix such a hell. The guy had to go through a lot of surgeries and spend some time in the hospital. He was lucky that he was still young and healthy, though not very smart. Otherwise, I do not even know what would have happened. A few months later, he turned up with us again with some other problem. I don't know what happened there, but he lost weight from 68 kilograms to 41 kilograms, and I saw him being fed through a tube. The dude came to the outpatient clinic with a swollen left testicle and began to explain that his girlfriend, with his consent, injected him with cayenne oil there so that he could stay in bed longer. It was extremely difficult for me, an intern, to contain my emotions. When I introduced myself to the patient, I said that I would be his anesthesiologist, to which the patient replied that he did not want me to be his doctor, because anesthesiologists are not doctors. Shortly before that, there was another guy who asked me if I needed to go to university to become an anesthesiologist, and another one asked if anesthesiologists need to know as much as pharmacists. A story on the topic from my oncologist-gynecologist friend. He had a patient with early uterine cancer. When he offered to operate on her, the patient refused and decided to try alternative treatments, such as coffee enema, meditation, and other nonsense. With her problem, she even somehow got to the Dalai Lama, who advised her to return to her doctor. I am a dental student. One of our patients is a pathological liar. 1 minute he's telling us that he's studying at med, the next he's telling us that he was a dentist in the army, and the last time he told us that he has a doctorate. This patient is always talking shit like, "Hey doc, how do I turn my head, distally or medially? Number, I need you to turn your head to the right. Hey doc, are these holes in my teeth because of antimicrobial microbes? No, it's because you only eat sweets and don't brush your teeth." A patient with a cold came to the emergency room and demanded that I prescribe antibiotics for her. I tell her that they are not prescribed for viral symptoms, but she insisted so much that I had to give her a little educational course on viruses, bacteria, antiviral drugs, and antibiotics. I hope it helped her pass her final exams. I haven't forgotten. Should I say that she was a medical student? A 20-year-old girl with abdominal pain came to me. I gave her a pregnancy test. It turned out that she was pregnant. There was obvious surprise on her face, because according to her, she drank birth control pills. I asked her how long she had been drinking them, and if she drank them daily, as written in the recipe. To which she replied that since her sex life was not regular, she did not drink pills every day. I looked at her, barely able to contain my laughter. It turns out she only drank them after a night out with her boyfriend. Oh man, here are some idiotic cases from our emergency room. 1. A woman came to us because she was stung by a bee. There was no allergic reaction, no problems. Her arm just hurt. 2. Another woman brought her child because he was stung by a bee. Also, no allergies, no other complaints. 3. Once a whole family came to us because they found a dead mouse in their house and were afraid that they were now sick with something. 4. A woman came complaining that she had a second-degree burn on her arm. The wound was the size of a tic-tac. 5. A woman once told me for 5 minutes that vaccinating dogs leads to canine autism. I came to the family to tell them the sad news that their relative is about to die, as her tests are incompatible with life, pH 6.6, lactic acid 25. In response, her family asked me to put ice in her panties, because it should definitely bring her back to consciousness. No, I don't do that kind of stuff. Then she died and her family tried to wake her up for some time. In connection with my work, I often have to deal with heroin addicts. They all have a belief that if you overdose, you need to put ice in your underpants and you'll walk away right away. But so far, I have not heard a single clear explanation of this story. I am an ophthalmologist. He told the patient that he needed reading glasses. He couldn't believe me. Then I explained to him that there was nothing wrong with that. Since presbyopia, senile vision over time, it appears to everyone. His response, "Oh, come on. I haven't heard that George Clooney needs reading glasses." Well, first of all, he really needs them. Secondly, I don't understand why you compare yourself to him at all. Oh my God, it's my time to shine. 1. A man brought his wife to the emergency room. There is a 7 by 7 centimeter ulcer on the leg, diabetic foot syndrome, from which yellow-green pus with some maggots flows. I quickly examine her and send her to the surgical department. The husband begins to think that he needs to check her kidneys first. "Doc, it's just a wound. Check her kidneys first. I read on the internet that they can fail because of diabetes. Do something about it." He had to explain for an hour that his wife would rather die from sepsis than from a failed kidney. 2. I'm examining a child with measles. His parents, ardent opponents of vaccinations, are sitting next to me and yelling at me, "Why the fuck doesn't modern medicine still have a cure for measles?" I tried to explain that there is actually one preventive measure that they decided not to use. Well, it was possible to get vaccinated. Are you from the pharmaceutical lobby too? Yes, anyway. I am a pharmaceutical lobbyist. Thanks a lot for watching. Subscribe to the channel and like it.